Hello, welcome to Mountain Care Pharmacy's tutorial on using the multi-dose pen injector. My name is Alex, I'm the pharmacist in charge here, and I'm very excited to be going over the step-by-step process with you of administering your medication. We know that the process of doing an injection can be overwhelming at first, but we're here to make sure that you feel safe and confident in the process. And hopefully our pen injectors make everything a little easier as well. First, you'll begin by getting your box that we've shipped to you. When you open your box, you'll see that you have a pen injector, alcohol swabs, and needle tips. We provide 5 needle tips should you need one. If you are injecting more frequently than once a week, we do recommend contacting your provider for an additional pen needle tip prescription. If the box arrives warm or frozen, it is still safe to use. We have done temperature studies at both extreme temperatures from a third-party lab to ensure the potency and stability of the medication. To begin, you'll clean the area with your alcohol swab, either the stomach, upper thigh, or back of the arm. While the alcohol is drying, you can take your needle tip, uncap your pen, and screw it on to the end of the cartridge. Next, you'll want to set your pen dose. The instructions on your label should be in milligrams, and you'll notice the injection markings on your pen are also in milligrams. You're going to dial it to the specified dose per your label. If you are unsure of your dose in milligrams, please refer to the conversion chart included in your box. For example, if your previous dose of semaglutide was 1 milliliter, you can see that your dose is 2 milligrams as your new dose, or 0.4 milliliters. As mentioned, the dose on your pen will be in milligrams, so you would dial it to the 2.0 milligram mark on your pen. Now, let's take a look at what your prescription label will look like. Each label may appear slightly different depending on your medication, but all include the same important information. At the top, you'll see your name, and below the prescriber information. Just below your name is the name of your medication, the strength, and your specific dosing instructions. This section explains exactly how and when to use your pen injector. You'll also find the date it was dispensed, the quantity filled, and the expiration date. If your medication needs to be refrigerated, has refills available, or includes special handling instructions, you'll see that clearly printed here. You'll also find Mountain Care Pharmacy's contact information if you have any questions. Before using your medication, always take a moment to review your label and confirm that everything matches what your provider discussed with you. If you ever have questions, please reach out to us or your provider for help before using your medication. Once you've set your pen to the appropriate dose shown in the dosing window, you're ready to inject. Pinch an area of skin and insert the needle at a 45 to 90 degree angle. You're going to want to place your thumb on the plunger and depress slowly but with force. It may take a bit of pressure and a few seconds to fully administer the medication depending on your dose. You'll want to leave the needle inserted for an extra second or two just to ensure complete medication administration. Make sure to rotate injection sites weekly. You can then uncap your needle tip and dispose of it in a proper sharps container or a container with thick plastic such as a milk jug or water bottle. The medication will last 28 days. There's enough doses for 4 injections. You may have medication left over in the cartridge. We do recommend disposing of this after 28 days and requesting a refill from the pharmacy. In the meantime, please place your medication in the fridge for storage. We hope that you enjoy our new pen injectors. If you do have any questions, please feel free to always reach out to us via message or phone, or consult with your healthcare provider on any additional questions. Thank you for watching and stay safe.